Beginning the session in another minute. Good evening, all. Good evening, dear students. Welcome to live session for images rapid revision for the subject of DADH. Hope I'm audible and visible to you all. Okay, good evening, Dr. Archita Saroj, Dr. Shubhangi Mishra, good evening. So is the audio and the visual clear? Okay, good evening, Dr. OMFS, Gaurav Sharma, Sunaina, Dr. Prerna. So are we good to start? Okay, thank you, Dr. Prerna, for the confirmation. So let us begin with today's live session, images rapid revision for the subject of dental anatomy, dental histology. This subject is considered as one of the dry subjects by most of the students, but equally important, as important, the importance you give to other subjects, and especially these image based. See, what's the purpose of this rapid revision? With the help of images, we are enhancing your pictorial memory. We are enabling you to remember these concepts through perception. It's not that we are just restricting ourselves to that one image, but there are a lot many things related. Concept is also being getting cleared through that. Pointing at in this present picture. So when such pictures comes, first try to identify which structure the arrow is pointing towards, from where the picture has been taken. Which part of the tooth are we talking about? So here we are talking about enamel at the top and dentine at the bottom. Okay, we could easily make out the junction between the two, the DEJ, and these are the arrows which have been asked in the question. We can see two separate lines being coming here. So we are asked to demarcate what are these lines. So we could see that some part of dentine is present here, some part bulk is present here. Similarly, some part of enamel is here and bulk is here. So basically that some part of enamel, some part of dentine is formed before birth, which is getting differentiated from enamel and dentine, which is formed after birth. So that's a kind of an incremental line which is more accentuated, which is more prominent. So that is neonatal line. Okay, so these arrows, they are pointing towards the neonatal line. Now neonatal line is a type of incremental line. Okay, had this not been given in the option A, then second option is also correct. Neonatal line is a type of incremental line. As we say, Ritzius is for enamel incremental line and incremental lines of von Ebner in dentine. Then both B and C would have been partly correct. Okay, if neonatal line is not being given. So neonatal line is nothing but an exaggerated, prominent, something which has become more dark in type of incremental line. Okay, we know that incremental line, they are called by Ritzius, the scientist who discovered in enamel. In dentine, it is, they are called as von Ebner. In bone, we call them as resting lines, and in cementum, they are named after the scientist Salter. So except for the incremental lines in all the mineralized structures, like except for the incremental lines which are seen in cementum, incremental lines of Ritzius, von Ebner, resting lines, they all are considered hypomineralized, except for incremental lines of Salters which are hypermineralized. That is why incremental lines of Salter are also used in forensic odontology as age estimation, okay, as one of the important parameter for age estimation. Okay. Sir, one question regarding taking radiograph of incinerated bodies for identifications, and option were tongue, cheek, nasal septum and teeth. Okay. Is it related to neonatal line? No. Sir, was Radiograph incinerated bodies for of liver, tongue, cheek, nasal septum, and teeth. See, the question is not complete, Saurabh Gandhi. Just share the snapshot in the doubts group for the same question. Yes, Ayush Jain, in the cementum, we call them as incremental lines of Salter and they are hypermineralized. Okay. So, in which all teeth neonatal line is seen? They are seen in all the primary teeth. So many questions related to neonatal line. But only permanent tooth to show neonatal line is first molar. Okay. Sometimes they attach the central incisor also, but ideally it is just the first molar. The mineralization of first molar starts at birth. Okay. Moving on to second question, the type of cells present in cementum as shown in the figure. Now you could easily make out there is a cell body and these are the canaliculi. So, and these canaliculi, they are not encircling the entire cell body. That is something specific for cementocytes because cementum, it derives its nutrition from PDL. So all these canaliculi, they are directed towards only PDL. They are not directed towards. You won't see canaliculi on the other end. That is, dentin is present. Dentin itself is avascular, so it is not dependent on dentin. Rather, it is dependent on periodontal ligament. So this is a cellular cementum that contains cells. The space where the cells are present are called as lacunae, and the cellular processes are present within the canaliculi. Okay, so these are the spaces. Lacunae contains the cell body, whereas canaliculi contains the cell's processes. Okay, since this is something mineralized, within the mineralized component, the empty spaces that contains the cells are called as lacunae, whereas the spaces that contains the cells processes are called as canaliculi. So these are the cementocytes. Okay, this is how we differentiate them from osteocytes. Osteocytes will have canaliculi all over. Okay, this is an diagram for osteocyte. Okay, that will be more rounded, whereas cement, this is more tubular, this is more elongated. These cementocytes, they are more tubular, more elongated lacunae, whereas osteocytes lacunae, they are more rounded, more spherical or more oval in shape, whereas for cementum they are more elongated. Okay. Yes, identification is done by ideally removing tongue part there. That's from forensic odontology. How do you carry out the post-mortem for investigation? So most likely it is tongue over there. Okay, Saurabh, we'll still get back to that. I had seen that question, what you are referring to. Okay. Next is the type of cemento enamel junction shown in the figure. Now here, this is basically a picture taken from 10 kits. A polarizing microscopic image is there. Okay, when you see different shades, this is not any stain. This in under polarizing microscope, this is enamel, how it looks like. This is cementum, how it looks like. Okay, so here we are seeing the part of cementum is covering, especially look at this part, it is covering the cervical third. This part is overlapped by cementum. So this is straightforward overlap type of CJ that is seen in 60% of permanent teeth. Maximum is overlap. Okay, if we talk about other two, 30% is butt joint and 10% rarest of all is gap joint, where they do not meet at all. This butt joint is the most common type in primary dentition. Okay, so just read the question statement completely. Are we referring to primary or permanent? If nothing is mentioned, then we take it for granted that it is permanent. Most common type of CEJ is overlap. If they have not mentioned primary or permanent, we are considering that they are asking us for permanent teeth. If they specify most common type of CEJ in primary dentition, then we'll go for the butt joint, end to end, right? Which type of cementum is formed in overlap? This cementum is afibrillar, acellular cementum. This cementum is covering the coronal part of the enamel. This part, this type of cementum is called as coronal cementum because it is covering the enamel part. Enamel is something which is seen on the crown. Okay, this is also known as coronal cementum because it is covering a part of crown. Rest of the cementum is radicular cementum, that is by definition cementum is present over the root. This is something exception is there. 60% of the CEJ Jyoti is seen in overlap type in permanent dentition. Okay, when we say most common type of CEJ in permanent, that is overlap type. Okay, permanent teeth or permanent dentition. Moving on to the next question, the dentine present in the apical region of the ground section shown in the figure. Even the site also they have mentioned, and looking at the picture also we can easily make out that this entire part has become transparent. This is transparent dentine, also called as sclerotic dentine. Often this sclerotic dentine or transparent dentine is preceded by, means पहले क्या होगा, by dead tracts. Okay, dead tracts appear dark in transmitted light. Okay, they will appear dark in routine. What light we are using? We are using transmitted light. So dead tracts, when the tubules are empty, they are filled up with air. That is why when light is transmitting through them, they are appearing dark in color. Okay, but when the mineralization takes place within the tubules gets filled up with the minerals, so that the refractive index becomes same in that entire region. Okay, tubule के अंदर भी mineralization हो गया, sclerosis हो गया. Sclerosis means something becoming very hard. Tubule has become so hard because it is filled up with minerals. So since the refractive indices gets equalized, it appears transparent. So sclerotic dentine is filled with minerals. Okay, this can be asked separately, whereas dead tracts, they are filled up, they are empty, the tubules, they are filled up with air. Okay, now with increasing age we take the reference from the apex. It is increasing from the apex going towards the cervical turn. So this is happening with increasing age. The formation of transparent dentin also increases. That is why this is used separately, as well as one of the important parameters used by Gustafsson. Gustafsson gave 6 parameters for age estimation. One of such parameters is sclerotic dentine. Okay. Predentine is unmineralized. Osteodentine is tertiary dentine, type of tertiary dentine, where the odontoblasts are getting entrapped. Okay. Reparative dentine is also called tertiary dentine. No, we will not call reparative dentine tertiary dentine. Reparative dentine is a tertiary dentine, correct? I thought you were asking sclerotic. Reparative dentine is a kind of tertiary dentine. Yes, as we said, two types. One is reactionary, one is reparative. They both qualify for tertiary dentine. Okay, reactionary dentine as well as reparative dentine, they both qualify for tertiary dentine. Okay. Next is, as I mentioned in this one itself, the dark colored dentinal tubules as shown in the figure. So what is this area, dark colored? Now these tubules, they are filled up with air. Here the odontoblastic process has undergone atrophy. That is the content of the dentinal tubule, the fluid, the odontoblastic process. Now that has already gone degenerated. खाली है, सिर्फ हवा रह गई उसके अंदर. So when the light is getting transmitted through them, under transmitted light, they would appear dark in color. Okay, right? So just this is the common phenomenon, the normal source. I'm not telling you the other. You don't get confused yourself. Unless and unless they don't mention anything, we take it for granted that they are talking about transmitted light. Okay, if they talk about reflected light, then the color will be different. So remember, D for dark, routine light, that is transmitted light. Sclerotic dentin is transparent, again in transmitted light. Okay. Next is the pattern of enamel rods in cross section as seen in the picture. Now you could easily make out the shape we had discussed. Such type of shape is called as keyhole pattern. So in this keyhole pattern, we have the head part, which is always facing upwards towards the crown, and this is the tail part that is facing towards the root part. Okay. when we take the long axis of this rod, this is one rod, one keyhole is one rod. So we say that this rod is filled up with hydroxyapatite crystals. So these crystals, hydroxyapatite crystals, they are laid parallel to long axis in the head part. Okay, this is we are talking about in the head region, they are parallel to the long axis. Whereas they deviate when we draw the long axis like this, they are going in different directions. So they are forming an angle. In the tail part, their deviation is 40 degrees to 65 degrees. To be more specific, if we are using X-ray method, then 40 degree. If we are using electron microscope, then the values is 65 degrees. Okay, if both the figures are given and they have not mentioned the source, then we will take the more accurate one, that is 65 degrees through electron microscope. Okay, is that clear? One ameloblast contributes in the formation of the head part. Okay, whereas three ameloblasts from three different directions will contribute in the formation of tail part. So one rod requires how many ameloblasts? Four ameloblasts will together make one rod. Okay, wherein one is consumed for the head, three from different directions, three ameloblasts will contribute in the formation of tail part. Right. Next is the direction of the enamel rods as depicted in the figure resembles to. Now this is the simple diagrammatic representation of enamel rods. This is not we usually see even in light microscope. They are plenty. They are in millions, 5 to 12 million on an average. Just to explain the orientation, this is the diagrammatic representation. As you could see, they are almost vertical when they are approaching the cusp in the occlusal. Then they are becoming slanting in the middle third. And in the cervical third, this area is the difference. As per the options also, the examiner is trying to identify whether it's a primary tooth or a permanent tooth. Same question, they have put it in a different way. Okay, previously it used to come like what is the difference in the arrangement of rods in the cervical third of primary and permanent tooth. Now they have shown us the picture और अब कान को बोला है कि उल्टे हाथ से पकड़ो. Okay, so we can easily make out that these rods, they are going in the cervical direction or slightly horizontal direction. So in permanent teeth, they are going gingivally or they are going cervically. Okay, they are, none of them are horizontal here, though it is approaching horizontal, but look at this ones, especially the ones in the cervical third where you will see maximum difference. Okay, because for primary teeth we sometimes use the term horizontally. In the cervical third, the direction of the rod is horizontally, or to differentiate, better word is they are going in occlusal direction. Okay, so for deciduous it is occlusal, for permanent it is gingival. Right, gingival or cervical can be used interchangeably. Similarly, horizontally or occlusally can also be used interchangeably. I hope everyone was clear about this. That's the reason gingival bevels are not given in primary teeth. Okay, when the restorations are to be done in cervical third. Next is the structure labeled by arrows in the figure is. So they want us to identify this structure. See, we are seeing here, basically this diagram is taken from a cap stage. They are not asking us to identify which stage of tooth development it is. Okay, although they have labeled here enamel organ, we are seeing the shape of enamel organ is like a cap, and in this area, this connection, this is called as dental lamina. Okay, this, and we are seeing two islands which contain some connective tissue in this. So this appearance of islands that are filled with connective tissue in the region of enamel organ, this is called as enamel niche. Okay, We know that 5 transient structures are formed during the cap stage related to enamel knot. It begins with the knot. When the knot elongates further, it becomes a cord. When it gets attached onto the outer enamel epithelium, it becomes septum. The point where it is getting attached at the outer enamel epithelium is called as enamel navel. There is a depression there. Now, when this enamel septum is being formed in the cap stage, during sectioning, when tangential sectioning takes place, so what is surrounding the enamel organ already is dental follicle. So we see some part of this enamel cord, it is seen, or we are seeing the islands of the connective tissues surrounded by the region of enamel organ. So these are basically structures which are created artificially. Okay, this is an artifact. This is not something actually present. Because of the sectioning, it has been seen, that is called as enamel niche. Okay, a very out of the box question. Here they have asked the diagram for enamel niche. Usually they ask enamel knot or enamel cord. Now that has become very obvious. This is the last step in enamel knot. Okay, enamel niche is least or rarely asked. That is why if you know niche, we take it for granted that you will easily answer what is knot, what is cord, what is septum, and what is navel. Okay. Okay, gingival bevels are not given in primary teeth. When you are restoring the cervical third in primary teeth, gingival bevels are not given. That you would have done in pediatric dentistry also, restorative dentistry may, because of the arrangement of the rods is such that in the cervical third, in deciduous teeth, they are aligned horizontally or occlusally. Okay, that is why bevels are not recommended in primary teeth. Okay. Next is the missing labels in the figure is. So again a diagram from cap stage now. Now they have asked us an easier one. They have labeled that this is enamel organ, this is follicle, this is papilla. What is this one? The blank here. So here we are seeing the condensation. Now though it has become elongated from knot to enamel cord, now you will say cord is not there. So the closest answer is enamel knot. So this acts as a signaling center, especially it controls the shape of the cusp. Okay, so that's a diagram for enamel knot. That is a transient structure exclusively seen only and only in cap stage, right? Next, question number 10. Before enamel forms, some developing odontoblastic processes extend into the ameloblast layer, and when enamel formation begins, they become trapped to form. And they had shown picture also, and they have put arrows. What are these structures? So these are the refuges. These odontoblastic processes, they were supposed to be contained within the dentinal tubules, within the dentine part. They were not supposed to cross the DEJ, but galti se kar gaye during development. Okay, so that's a kind of ectopic thing. Something should be present in the dentine, but now it has come in enamel. So these overextended odontoblastic processes, these are called as enamel spindles. Okay, so what do enamel spindles represent? They represent overextended odontoblastic processes. Okay, they might ask what is the source of enamel spindles. Another way of asking question, that they are origin is from neural crest cells, or their origin is from ectomesenchymal cells, right? What is, they are not they are seen in the enamel, but they are not made by ameloblast. Okay, enamel tufts will also be seen along the DEJ. From the DEJ we see groups. Okay, these are again hypermineralized structure like tufts of grasses. Tom's process is the another name for your extension. of ameloblast, that is Tom's process. Okay, interglobular dentine is unmineralized dentine, right? Moving on to next question, question number 11. The incremental lines seen in the figure are known as, what are these incremental lines? You can make out, first identify, this is your dentino-enamel junction, this is dentine, this is enamel. So here we are seeing clearly lots of these lines going. What are these? These are incremental lines of Ritzius. Okay, all are the names for the incremental lines. Ovens are more accentuated form of von Ebner lines. Okay, since bulk of the picture is showing enamel and majority of the incremental lines in enamel are shown, so we will go for stri of Ritzius. Okay, incremental lines of Ritzius. Question number 12. A 20-year-old male reported to the clinic with a complaint of asymptomatic 2 by 2 centimeter swellings in the region of hard palate since last 5 years. Upon biopsy, the following histological picture was seen. Identify the structures. They have given a clinical description here. Looks initially that they might be asking us about pathology, but then they ended up asking a histology related question. Okay, they have not asked identify the pathology here. What lesion? Nothing. Just the site they have mentioned, and looking at the picture, we can easily identify lots of these where I'm putting A. These are the serous acini, darkly stained. Okay, and now you can easily point out two lightly stained structures here, the smaller one and the bigger one. This smaller one is the intercalated duct. Okay, intercalated duct, they will be lined by cuboidal cells. Okay, as you're looking at this, this is a small circle, these are the cuboidal cells, this is intercalated duct. The bigger one which they had asked also, and there is an arrow also here, though arrow is missing, that is lined by columnar cells, that is a striated duct. Now another name for striated duct is Pfluger ducts. Okay, this name is very rarely used. Okay, that's the reason I have brought this question here. That's an alternate name for striated duct. Okay, P is silent, it is Pfluger's duct, and that is another name for striated duct. See, striations are not seen in routine microscopy. Light microscope में नहीं मिलेगा. Striations are only seen in electron microscope. And what is the reason for these striations? These striations are because of enfoldings of plasma membrane, right? The plasma membrane is folded, and within this folded, what has been entrapped? Large sized mitochondria are entrapped. Okay, that is why these are the site where active exchange of ions or electrolytes is taking place. Okay, when the saliva enters the striated duct from the intercalated duct, it is hypertonic, tonicity is more. When it leaves the striated duct, it becomes hypotonic, tonicity is decreased, or at least it becomes isotonic. What is happening? Exchange of ions is taking place in striated duct. Sodium ions, chloride ions, they are getting reabsorbed. Okay, in exchange, potassium and bicarbonate ions are getting released, but to a lesser extent. काफी सारे ions वापस चले गए, लेकिन return में कम आए. So ultimately the tonicity decreased. It became hypertonic and isotonic to plasma. Okay. So that's another name is Pfluger ducts for striated duct, right? So when you see such structures, you can easily make out the darkly stained acini are there, those are the serous acini. Okay, the bigger ones are usually the ducts. Next is identify the structure marked B in the following image of ground section of the tooth. So here basically C is your acellular cementum, right? A is dentine, as you could make out the dentinal tubules. lots of dentinal tubules. And what is this? These dentinal tubules, they are ending up dotted appearance. This is what they are asking us, B part. Okay, I have just highlighted it. As we are going more deeper, means more towards the, this is the apical end, it is becoming more thicker. This is the cervical end. So thickness is increasing as we are moving from cervix to apex. Thickness of cementum is also increasing, and thickness of Tom's granular layer also increases. So this is happening because the ends of the dentinal tubules, they coalesce with each other. आपस में एक दूसरे को जादू का झप्पी दे रहे हैं. So when we are sectioning, it appears granular. So that's the reason for formation of Tom's granular. Like in enamel, we have seen gnarled enamel. Similarly, here this is Tom's granular layer. The dentinal tubules, they are entangled with each other. So when we are taking the tangential sections, it appears in the form of granules. The thickness of Tom's granular layer, it increases as we move from cervical third towards the apical third. Okay. Striated ducts are in continuity with intercalated ducts. Yes, Ayush Jain, they are in continuity with intercalated ducts. But in histological diagrams, since what we are seeing is just a two-dimensional picture. In three-dimensional model, we can see that these are connecting. The intercalated ducts, they are pouring their secretions into striated ducts. Okay. लेकिन जब भी हम pictures देखेंगे या diagrams देखेंगे, we will see them separately because they are present at different levels. Okay. कोई ऊपर है, कोई नीचे है. So even if there is a connection below, we will just see them as detached from each other. Okay. I hope that clarifies the doubt. Enamel tufts, processes, enamel lamella, you all are aware of. So that was about Tom's granular layer. Now moving on to the next question. Identify the eruption phase of the following image. So as you could see A, B and C. So whatever movement is taking place, it's all intra-alveolar, within the alveolar process. Okay. It is within the alveolar process. And there is no, the tooth we are seeing here that the crown is being formed, but crown has not moved up. We know that in which direction the eruptive movement takes place, axial or occlusal. That is not happening. The arrow is just showing, okay, that some kind of bodily movement, but within the alveolar process, as if they are preparing themselves for eruption. So this is pre-eruptive phase. Okay, three kinds of eruptive movements: pre-eruptive, eruptive, post-eruptive. So the one which is taking place within the alveolar process, they are considered pre-eruptive, means before they make themselves ready for eruptive tooth movement. Eruptive will always be in axial direction or occlusal direction. Very commonly asked question. Eruptive tooth movements, what is the direction? Straight upwards along the axis. Okay. Pre-eruptive, like deciduous incisors, initially they are aligned lingual to the root end of uh, sorry, the permanent incisors, initially they are aligned lingual to the apical end of the primary interiors. Okay, whereas from lingual they move in the apical direction, they align themselves ultimately as and when the resorption of root takes place, they align themselves from lingual to apical direction of the roots of deciduous anterior teeth. So this movement in anterior from lingual to apical direction is called as pre-eruptive. For maxillary molars, initially the occlusal surface of the developing tooth germ, it is facing distally. So as the jawbone grows from distally, it will come and align itself occlusally. Mandibular molar, initially it is aligned mesial direction. As the mandible elongates from mesial, it will become vertically straight. All these kind of movements are called as pre-eruptive movements. Next is, in which of the locations is the following epithelium found? So first, they are not asking you to try to identify the epithelium. First thing you should do that, try to identify. We can see here different layers of nuclei can be seen, looks like stratified, but here we are looking at cilia also. So this is basically pseudo stratified ciliated columnar epithelium. Where do we find this? We find this in maxillary sinus. The lining of maxillary sinus is pseudostratified ciliated columnar epithelium. This lining is also known as Schneiderian membrane. So it contains ciliated cells. It also contains goblet cells. What you're looking at here, this one, this is a goblet cell. Goblet cells, they are behaving like a unicellular gland. एक ही cell gland का काम कर रहा है, secretions they are producing. And these empty cells in between, these are basically the mucus cells. Mucus cells are also present along the epithelium line. Tongue will be stratified squamous, keratinized. Hard palate will also be keratinized. Okay, floor of the mouth will be non-keratinized but stratified squamous. Okay, this is tall columnar cells but pseudo-stratified ciliated columnar epithelium. Now next is, in which of the areas is the following type of epithelium is not seen? This is important. Not such words, except, all. Just read the statement carefully. Now first try to identify the epithelium. What kind of epithelium are we looking at here? Epithelium that has got rete ridges. Okay, this is the connective tissue, and we are seeing a prominent layer coming here in the superficial zone. And then there are a few flakes also. These flakes are like onion skin, flakes of keratin. So this is basically orthokeratinized stratified squamous epithelium. Now coming back to question, in which areas it is not seen? So it is seen in gingiva, yes. Is it seen in hard palate? Yes. Is it seen in vermilion zone? Vermilion zone is the area where we apply the lipsticks. So the outer part, which is lined by skin, yes, that is orthokeratinized stratified squamous epithelium. Not the inner part. Inner part is your labial mucosa. That is non-keratinized. To some extent, vermilion zone, yes. To some extent, no. Do we have a better option? Yes, soft palate. We know that this is completely covered with non-keratinized epithelium. So answer here will be soft palate. Okay. First, try to identify which epithelium, whether it is keratinized, non-keratinized. Look for keratin. So in this picture, we could easily make out some keratin flakes were there. Now, one which you have identified it is keratinized, go for whether it is para or ortho. So ortho, you will clearly see the prominent stratum granulosum. Stratum granulosum, dark color का layer दिख जाएगा superficially. Granules are very much prominent. Okay. Then, if the picture is clear enough, unfortunately it was not that very clear here. So look at the presence of nuclei. If no nucleus at all, orthokeratinized. If ignotic nucleus is there, then parakeratinized. Next question, identify the cell marked with arrows in the following image. So now here, what arrows they are denoting? There is a cell that has a nucleus placed away from the center, eccentric nucleus, right? Darkly stained cytoplasm, darkly stained nucleus, which is eccentrically placed. So it's looking like a flame shaped cell. So these are plasma cells, inflammatory cells. If we see the nucleus, though it is not visible in light microscope, this feature, that nucleus has an arrangement of cartwheel shaped nuclear material. Okay, so cartwheel shaped arrangement of nuclear material is seen, right? Cartwheel की तरह. As well as these, we know that they are responsible for forming immunoglobulins in many cysts. The rounded spherical bodies, eosinophilic bodies are seen, radicular cyst, periapical granuloma. Those are Rushton bodies. Sorry, those are Russell bodies. Okay, those are Russell bodies. Okay, Rushton bodies will be curvilinear. Russell bodies will be rounded. So, source of Russell bodies is plasma cells. Rushton bodies source is not known. They will be curvilinear, hairpin shaped of unknown origin. So this is path associated with physiological, normal histological part, right? So plasma cells, they can be seen in the oral mucosa. They are also seen in pulp, okay, as well as they can be seen in periodontal ligament, soft tissue part also. Ordnance bodies are seen in stratum granulosum or stratum spinosum. Priya, we will go for stratum spinosum. Ordnance bodies, that was the final verdict, and we will stick to it. Okay, unless and until they specify where is the site of function of ordnance bodies, then we will go for granulosum. Otherwise, we will stick to stratum spinosum. Next question number 18. Identify the type of cementicles in the image. So they have told that this is the cementicles. So what are cementicles? These are the mineralized products that are seen in PDL. Okay. So the mineralized products seen in pulp were called as denticles. Proximity में कौन सा hard tissue था? Dentine. Now PDL is also soft. Proximity में which hard tissue is present? Cementum. So we are calling them as cementicles. Like denticles is equal to pulp stones. Similarly, we can say cementicles is equal to PDL stones. Okay, mineralized product seen in the periodontal ligament. Periodontal ligament is a soft tissue. So both can either be free, attached, or embedded. Cementicles, the three types, free, attached, or embedded. If they are surrounded by PDL alone, we will call them as free. If they are partly in PDL and they are partly attached with cementum, we will call that as attached type. And if they are completely surrounded by cementum alone, secondary cementum has formed around, all around this, then it is called as embedded. For denticles, everything will be same, just we are replacing PDL with pulp and cementum with dentine over there. Okay, so now looking at this picture, this is your periodontal ligament, the cementum part. This is the cementicles. So which kind of cementum? This is partly in PDL and partly in cementum. So this is attached type. Okay, embedded, we'll see more. If this more cementum forms here, then it will become embedded type. Okay, but till this it is attached type. Now next, identify the following tooth. So in such questions, okay, so we can easily make out that this is a premolar. Now is it first premolar, second premolar? We can see this groove coming here. What we are looking at here is the proximal aspect, the mesial aspect of mandibular first premolar. Okay, we can see this, there is a bigger buccal cusp is there and a very small lingual cusp is there. The slant is so high and there is a groove. This is the class exclusive trait that is present only in mandibular first premolar. We call this as mesiolingual developmental groove, one of the identifying feature for this. And also we are seeing here that there is a slight lingual tilt. Look at this. So this part of the crown is unsupported by the root. This part of the crown is called as lingual overhang. The part of the crown which is not supported by the root. Root से बाहर जा रहा है थोड़ा सा because of the lingual tilt. So this is lingual overhang. Okay, mandibular first premolar can one of the common tooth to have bifid roots. Now they say that mandibular canine is the most common, followed by mandibular first premolar. Okay, and which premolar is the most canine-like? That is again mandibular first premolar. Okay, which resembles canine in maximum ways. Most canine-like premolar. That's the question. Most canine-like premolar. Again, the answer is mandibular first premolar. Okay. Next is identify the following tooth. Again, another premolar here. Here we have buccal cusp, lingual cusp. Now we cannot how to identify whether it is first, maxillary second. Easily we can make out there is a hexagonal outline. Okay, so this is maxillary first premolar. Now, how to identify right side, left side? Always try to look at the features that help in differentiating which side is mesial and which side is distal here. Okay, so here, if we could trace, this is the central groove, and there is a groove that is traversing this marginal ridge, right? So this is the mesial side, this is the distal side. Okay, so when we imagine once you have ascertained which is mesial, which is distal, imagine putting this tooth into your oral cavity, which side the mesial would fit into. Okay, and then try to identify whether it is right side or left side. So this is right side maxillary first premolar. Okay, they can ask left also. Some students believe that mostly they ask only left. Okay, but this is right side maxillary first premolar. Okay, so here we have ascertained the mesial side first, and which groove? The groove is traversing the marginal ridge. This is mesial marginal ridge. So this groove is called as mesial marginal developmental groove, exclusively seen in maxillary first premolar. Okay, Dipesh Shabadia, you need to ask Sumit sir regarding this question. Let us just focus on DA/DH today. Otherwise, I will lose my flow. Okay, just concentrate on the questions what we are discussing. If anything you have not understood related to the particular question or related to the particular concept, kindly raise that query. Okay. Mesial side is bit longer, so this logic is also correct. Anything, Shubhangi, anything which is helping you out in determining which side is mesial, which side is distal. Okay, when you look at the grooves and all, that is the first thing that is pointed out. Okay, then obviously yes, the sides you can always compare. Sometimes in the proximal sides, the slopes, the difference between the slopes you can compare, which is mesial, which is distal. Whatever way is comfortable. But for side determination, always look for the features that help in determining the proximal sides. Next, question number 21. Identify the landmarks A and B shown in the figure. So A, this is something going this from the structure on the mandible, and this is the styloid process. So this is coming from styloid process, one ligament, one is coming from this the junction part, sphenoid part. Okay, so one is sphenomandibular ligament and the other is stylomandibular ligament. I hope this is your general anatomy also, an easier one to guess. Both are derived from the remnants of Meckel's cartilage. Both are considered as secondary ligaments in temporomandibular joint. Okay, the primary ones are the capsular ligament and the lateral ligament. Lateral ligament is also known as temporomandibular ligament. Right? This is general anatomy as well. Okay. Next is question number 22. The following picture depicts which age group? See, these days such type of questions are in trend. Okay. So while solving these questions, first of all, there is always a color distinction been given. So that helps us in identifying that some of them are deciduous teeth, some of them are permanent teeth. Okay. So that is why this distinction of colors is being used to make things easier for us. Now, secondly, just look at this. This is the occlusion. This is the level of the gingiva, what that demarcates, helps us in identifying which teeth have erupted and which have not erupted yet. Okay, so now in this sorry present picture, we can easily see that some 1, 2, 3, C, D, and E are seen. Okay, they are still present. They have not been exfoliated. Canine, deciduous first molar, and deciduous second molar. So, and at the same time, permanent first molar has already erupted distal to E. This is C, this is D, and this is 6. Okay, so first permanent tooth to erupt is first molar that has already erupted. So the age is 6 plus. Now look at what is the condition for central incisors. These have also been erupted. 1 and 2 is also been erupted. So you know that this maxillary central incisor, it erupts by 7 to 8 years. Lateral incisor erupts by 8 to 9 years. Okay, so the age is somewhere between 8 to 9. The last tooth, the mandibular central incisor, is 6 to 7 years. Mandibular lateral incisor is 7 to 8 years. Now maxillary lateral has also erupted, so it is more than 8. Okay, also you can see that the deciduous canine, the root resorption is taking place, but none of them has been replaced yet. Okay, none of the premolars have been erupted yet. CDE is still intact. DE is not been replaced by premolars. So clearly, the last tooth to be erupted in such type of questions, we need to identify which tooth erupted in the last, and definitely some data of eruption age is required. Okay, so that is why chronology table is important. This is 8 to 9 years. I will be discussing the chart I had shared with you at the end of this class, where there are different age groups taken from Wheelers. Mostly the question for such age estimation, they directly come from the standard textbook. Okay, so at least go through those images for the time being. That is the most important. Otherwise, you can solve it also. इसमें कुछ रट्टा नहीं है, provided you know the chronology. Okay, सबसे पहले याद क्या करना है, chronology. Then you can apply common sense and think which teeth have erupted and try to identify which tooth erupted in the last. That will help you in identifying the age. Next is the following diagram depicts. So they have shown the permanent teeth here: 1, 2, 3, 4, 5, 6, 7, 8. And something is, when we are moving from posterior to anterior, this is slanting like towards the incisal direction. Okay, this is cervical third, middle third, incisal third. So in the graph, something is moving towards incisal, or if I read it opposite, if I take it like this, then from anterior to posterior, this is going in the cervical direction. Okay, so which option fits the best? The cervical curvature of the maxillary teeth from posterior to anterior. In the graph, it is going more towards incisally. Okay, इसको घुमाकर पूछा गया है. So this, first of all, which teeth are been shown? Maxillary teeth are shown. So C and D are ruled out. So is the cervical curvature of maxillary teeth from anterior to posterior, or it is from posterior to anterior? Since we are reading the graph which is going in this direction, so it is from posterior to anterior. Okay, meaning option B ka bhi same hai. But as per the graph, what is it the diagram representing? Again taken from Wheelers. Okay, we know that when we move from anterior to posterior, the crown size is decreasing. So curvature of the cervical line is decreasing. लेकिन यहाँ पर क्या हो रहा है? यहाँ पर बढ़ता जा रहा है. It is more towards the cervical curvature is increasing. So we are reading the graph from left to right. Okay, basically the meaning is the same. As we're moving from anterior to posterior, crown size is decreasing and curvature of the cervical line is also decreasing. But here they are moving from cervical towards the incisal. The graph is going downward. That means curvature is increasing. Okay, you know that maximum curvature of the cervical line, maximum amount is seen in maxillary central incisor, mesial aspect. That is 3.5 mm. Okay. Little bit tricky question. Don't get confused. That what I have told you during the class earlier remains the same. As we move from anterior to posterior direction, the crown size will decrease, and so does the curvature of the cervical line. Okay. This also goes for contact areas. Yes, the same thing also applies for contact areas also. Yes, NOLA stages, Nidhi Mehta are also important. That chart also you would have done in your pediatric dentistry. Okay, that chart sometimes they do ask. Okay, now I have not seen recently in last 2 to 3 years any question on NOLA stage, but these were in trend some time ago. Okay, so just go through that 10 stages of development according to the NOLA. That chart is also important. Next is the given image of the primary dentition indicates which of the following molar relation. Now always when they ask the molar relations in deciduous teeth, we know that we do it in terms of terminal planes. So although this is used as the reference, the maxillary distal surface of maxillary second molar, but the names, whether it is mesial terminal plane, distal terminal plane, names are based on the position of mandibular second molar distal surface. So here the distal surface of mandibular second molar is placed more mesially with respect to the distal surface of maxillary second molar. This is acting as the reference because this is fixed, right? So that is why maxillary second molar is used as the reference. With respect to maxillary second molar, mandibular second molar is either mesial or distal. Then you name the terminal planes. Here they have clearly mentioned anterior posterior direction also. So it is clearly straightforward mesial step. Okay. If they are in line, then it is flush terminal plane. Opposite is distal terminal plane. Kabir Jaiswal will follow the chart with the 10 stages. Otherwise, ask Vivek sir once where what does the standard textbooks mention, majority of the textbooks mentions. We do consider the first stage 0 also, 0 to 9. Okay. Next, the following is a radiograph of the posterior maxilla. Which of the following teeth is always the most closely associated tooth with a feature marked as A? So again, an indirect kind of question. First of all, identify what is feature marked A. They're not asking what is A, but we can see that A is the floor of the maxillary sinus. And the question is which of the following teeth is always most closely associated tooth, means most nearest, most closely associated tooth with the floor of the sinus is, we know that maxillary first molar. Which root to be more specific? Palatal root. So maximum chances during extraction of maxillary first molar, root getting dislodged into the sinus, creation of oral antral fistula. If there is any periapical infection, creation of oral antral fistula. Okay. Second closest is maxillary second premolar, then maxillary first premolar, and then comes maxillary second molar. So here the closest association is with maxillary first molar, right? Question number 26. The given image highlights an important distinguishing feature of permanent maxillary molars. This feature is formed by the union of which of the following? Again, first identify what the two red arrows are indicating at. They are indicating at oblique ridge. Rhomboid outline, crown, occlusal outline is shown. So this is maxillary first molar. Structure is oblique ridge. Now, union of which of the following? How is oblique ridge formed? Oblique ridge, we know that in simpler terms, we have to take a flight from Malaysia to Dubai. Which component of Dubai, which component of Malaysia also they are asking. Okay. If you simply see The option B and D, distobuccal cusp, mesolingual, mesolingual. But it is the triangular ridge of the distobuccal cusp and distal cusp ridge of mesolingual cusp. Okay, so oblique ridge is formed by distal cusp ridge of the mesolingual cusp. This is distal cusp ridge, this is mesial, right? So this distal cusp ridge is forming the major component of oblique ridge, and this is the triangular ridge of distobuccal cusp. In the middle we have got the triangular ridge. So both, they have gone more details what exactly is forming the oblique ridge. It is a triangular ridge of distobuccal cusp and distal cusp ridge of mesolingual cusp. Next is the given image indicates which of the following occlusal curves. Now you're looking at the mandible from the front, frontal view. This is going in buccolingual, so that is curve of Wilson. Curve of Spee is observed from the lateral aspect, that will go in anterior to posterior direction. When we join these two, Wilson and curve will give rise to Monson. Okay. Bonville's triangle is there, that proposes that the distance between the center of the condyle and mandibular central incisors as well as intercondylar distance is same. They are forming an equilateral triangle. Next, which of the following is not a function of the feature marked in the figure? So what are the arrows marking it? The arrows are showing the embrasures, the freeways, the spillway spaces. So what is not a function? So preventing trapping of food in the contact area is a function? Yes. It helps in proper eruption of succedaneous teeth? No, nothing proposed like that. Protects the underlying supporting tissue during mastication? Yes, it protects the underlying gingiva. It serves to provide a way for the food to escape during mastication? Yes, that is why they are also known as spillways or embrasures, right? Next, question number 29. The given image depicts which among the following aspects of development of occlusion? So now what are they showing us? C, D, E are going to be getting replaced by 3, 4, 5. So in the options there is no space, spillways, leeway space, primate space. So I hope you would have guessed it by now. So that during, this is the eruption of canines, the premolars, they are going to replace the deciduous canines and the deciduous molars. So that is why this additional space is there. The mesodistal diameter of CDE is more than the collective mesodistal diameter of 3, 4 and 5. This difference is known as leeway space of Nance. Right? This is utilized in late mesial shift. And how much is the leeway space in maxilla? It is less. That is 0.9 mm per arch. Per quadrant, 1.8 mm per arch. So in total maxilla it will be 1.8 mm. This is 0.9 mm. And in mandible it is 1.7, almost double per quadrant. Right? Whereas in mandible it is 3.4 mm per arch. Okay, or it is almost double as what we see in maxilla. Okay, so this leeway space, it is being utilized in late mesial shift. Okay, we have a query from Dr. Deepshri as well as Dr. Aditi. Sir, hereditary enamel hyperplasia is seen in all deciduous and permanent teeth? Yes, it will be seen in both. So do we need to remember chronology of primary and permanent teeth, including first evidence of calcification? First evidence of calcification, at least for incisor, canines, and not all the teeth. Okay, second molar, third molars are usually not asked. First premolar is important, canine is important, incisors and first molar is important. Okay, see, for central incisor, for first molar, for canine, remember all the four parameters. Okay, these are the key. Mostly, most commonly, the most frequency of questions come from these teeth: first molar, canine and incisor. Okay, so even if you these three figures are on your tips, you don't, or you forget the other things, you can easily you land somewhere in between these two. Okay, that will help in ruling out the other options. Eruption timing तो सबका ही याद रखना है. Next, given here is the image of the occlusal form of the tooth. In which of the following teeth is this seen? So this is a premolar, and we could easily make out this groove is occlusal outline is Y shaped. So here there is a mesiolingual cusp, distolingual cusp, buccal cusp. So this is a tricuspid, three cusp form of mandibular second premolar. Okay. Another two occlusal forms what we can see is either a U type or a H type. Okay, both U and H type, they are seen in two cusp type. Okay, frequency, one of the studies found out that 46% individuals they had two cusp type, that is bicuspid premolar, whereas it is 54% had got three cusp type variant. Okay, so tricuspid variant is more common than bicuspid variant. How many lobes would be required for tricuspid? 5 lobes would be required. 3 lobes for buccal cusp, that is same for all the premolar. Okay, and 1 lobe each for one lingual cusp. Now since it has got two lingual cusp, so there will be one additional lobe requirement. So total number of lobes, it will be 5, not 4. Rest all the premolars are derived from 4 lobes. 3 lobes will make buccal cusp, 4th lobe will make the lingual cusp. This is the only exception where 5 lobes are required. Okay, Jyoti, palatogingival groove is seen in, or palatoradicular groove is seen in maxillary lateral incisor. That is also very important, very exclusively seen in maxillary lateral incisor. Next is, the given image is as seen in a 9-year-old child. The marked feature of the image indicates which of the following. See, age is important in such type of questions. You know that blue arrow is pointing out at mamelons and mandibular incisors. The central incisor erupts by 6 to 7, lateral by 7 to 8 years. Now already the child is 9-year-old. Still the mamelons we are seeing on the central incisor, the lateral incisor, they are intact. So what does it indicate? That they are lack of function of incisors. They are not contacting with each other. Okay, the maxillary and the mandibular. Could be an open bite, could be a reverse bite. Okay, any reason. Delayed eruption of incisors, no. Enamel hypoplasia, no. Is it fluorosis? No. So it is lack of function of incisors because mamelons are intact. They are not worn off because no attrition has taken place, no contact has taken place. Okay, so indirect way of asking questions related to mamelons. So what do mamelons represent? These mamelons, they represent 3 lobes that make up the labial surface. Okay, anterior teeth, they are formed from 4 lobes. Next, as Jyoti was missing, we have brought a picture for her. Fortunately, the question has come right at the brink. The given image of the maxillary anterior tooth represents which of the following deviations from the typical form? Yes, Jyoti, I hope this picture is clear now. That's the lateral lingual aspect of maxillary lateral incisor. The red arrow is pointing towards palatoradicular groove. See the prominent marginal ridges. The fossa is also V-shaped fossa, and this groove sometimes it extends onto the root also. This is called as palato-radicular groove or palato-gingival groove. Exclusively, what is exclusive is very, very important, seen in maxillary lateral incisor only. Okay, three grooves important per tooth. One is palato-radicular, one is mesial marginal developmental groove, that is maxillary first premolar, right? And mesiolingual developmental groove is mandibular first premolar. Okay, one is mesial marginal, the another is mesiolingual, right? Next, the feature marked in the diagram is a characteristic feature of the following. Now we have brought in mesial marginal developmental groove also. Okay, the red arrow, this is maxillary first premolar occlusal aspect. So maxillary first premolar, and the groove we are talking about is mesial marginal developmental groove, right? Next, the given image of the mandibular anterior tooth is indicated of which of the following features which is common to all the anterior teeth. So what are the arrows pointing at? Arrows are pointing at the bulge seen in the cervical third of the crown. What is this bulge in the cervical third of the crown? Straightforward, that is cingulum. Okay. Tubercle is a small form of cusp. For example, cusp of Carabelli can also be called as tubercle of Carabelli. Marginal ridges, they form the margins either on the lingual surface of anterior teeth or the occlusal surface of posterior teeth. Triangular ridges are also seen on the posterior teeth, occlusal surface. Next, which of the following deciduous mandibular tooth is last to exfoliate under normal conditions? So first, they have shown us deciduous teeth. Looking at the roots of the molars, we can differentiate. This is primary molars. And in the mandibular teeth, they have numbered 1, 2, 3, 4. So we need to remember the sequence, eruption sequence, exfoliation sequence. So which is the last to exfoliate? See, it is A, B, D, C, E. That's the eruption sequence. Okay. Now, here the question comes for the exfoliation. For exfoliation, we need to know the eruption sequence for mandibular permanent teeth. What is the eruption sequence for? Because these are getting deciduous teeth are going to be replaced by permanent teeth. So for permanent teeth, what is the eruption sequence? 6, 1, 2, 3, 4, 5, 7. There is no exception. 6 is coming first, 1, 2, 3, 4, 5, 7. So here we know that 3, 4, 5 is in sequence. So which is the last tooth to be replaced? 3, this though they have used the numbers here, don't get confused. 3 is basically D. Number 4 is basically E. So what do you think? Which tooth will be lost in the last? Because second premolar will erupt after the eruption of first premolar. So second molar will exfoliate after first molar. Okay. So it will be number 4 here. The answer will be the E. E is going to be lost in the last. Okay. That is exfoliate. Which tooth is last to exfoliate under the given conditions? First see which teeth are numbered. 1, 2, 3, 4. Don't get confused. These are not permanent teeth. Let us say that this is what they have numbered them as B, C, D, and E. Among this, which is the last one to exfoliate? That is E. Okay. Correlated with the mandibular teeth. This is different. This is going to be different for maxillary teeth. Okay, because maxillary teeth eruption sequence is different. Okay, now it comes. Which of the following deciduous maxillary tooth is last to exfoliate? Same thing. Good, we have kept both together here. So for maxillary teeth, what is in permanent maxillary teeth? What is the eruption sequence? We take 6, 1, 2, 4, 5, 3, 7. Or 6, 1, 2, 4, 3, 5, 7. Most accepted is both the premolars erupt before canine. Both the premolars erupt before canine. That means both the deciduous molars will fall before canine. Okay, so if we have to see B, C, D, E, which is the last tooth to exfoliate, both both the molars will fall before canine. So that is canine is the last tooth to be lost here in maxilla. Okay, number 2 is canine. So canine is last. I'll use the word primary. Primary canine tooth is last to exfoliate in maxillary teeth. Not for mandibular. Okay, mandibular it was second molar. In maxilla it is canine. Remember this. In permanent teeth also, the last tooth to be lost is often canine because of its good anchorage, self-cleansing property, convex surface is there. Yes, you are absolutely correct. Okay, next question. Which of the following is not a function of the marked feature in the diagram? Now, first of all, what are they marking at? Now, here they are marking the blue arrow, as you could see, at the contact areas. Even the red dots, they are marking at the contact areas. Now they are asking which is not a function of contact. पहले embrasure का पूछा था, अब contact areas का पूछा था. So prevents food infection, yes. Prevents rotation of teeth, yes. It protects endodental papillae, yes. It prevents dentinal hypersensitivity, nothing to do with dentine hypersensitivity. Okay. Moving on to question number 38. Which of the following permanent maxillary tooth is last to erupt? One second. Okay. Which is Now, which of the following permanent maxillary tooth is last to erupt? Permanent maxillary tooth. Again, question from sequence, but here they have numbered it differently. So, canine को उन्होंने B करा है number, deciduous first molar को C और second को D. Whatever the examiner says, that is correct. Don't bring in your knowledge, your notation system here. Okay, this is just for the sake of options A, B, C, D. They have numbered that among the central incisor, among the canine, among the first molar and the second molar, which one is going to erupt last. Okay, so for maxillary teeth, primary, sorry, for which of the following, sorry, my mistake. A, B, C, D is just for the options. They are not, there is no mention for primary teeth at all here. In the question itself, they have asked about permanent teeth. Okay, this is how we often get confused. A, B, C, D, देखकर लगता है कि they are talking about primary teeth, but here they are talking about permanent teeth, and just for the sake of options, they have labeled them as A, B, C, D. Okay, so in maxillary, as I have just told, eruption sequence क्या रहेगा? 6, 1, 2, 4, 5, 3, 7, right? So among this 6 and 7, which is the last tooth? Last tooth is second molar. Second molar as per the diagram is D. Okay, just okay. The given image is likely to be representative of which of the following age of the child? Now this is the gingiva. None of the teeth has erupted. All the deciduous teeth is there, the blue ones, and one spot, white spot, we could see that the permanent tooth has started forming. So this is the time at birth, mineralization of first molar. Also it is present distal to the deciduous tooth. Location is also clear. Mineralization has just begun. That is at the time of birth. Again, importance of chronology. Next, which of the following statement is not true regarding the feature marked in the image? So what are they showing? This is a occlusal aspect of maxillary first molar, right? What is the red arrow indicating at? Cusp of cerebelli. That is not the question. Now the question starts. What is not true regarding cusp of cerebelli? Is it a functional cusp? No, it is a non-functional cusp. Heritable feature है, yes, non-metric trait use करते हैं. Seen lingual to the mesiolingual cusp? Yes. Most commonly seen on permanent maxillary first molars? Yes. Okay. Also seen on deciduous maxillary second molars. Yes, A is canine. For the sake of options, A, B, C, D were being numbered, so don't get confused over there. Okay. Next question: the marked area is likely to be the orifice of which of the following salivary glands? So they have marked an orifice. We know that in this region, the buccal mucosa, the excretory duct, which excretory duct opens up in the buccal mucosa opposite to maxillary molars, that is parotid gland. Even if first and second is not that very clear in the picture, we'll go for parotid gland. Maxilla में एक ही खुल रहा है buccal mucosa में. Rest your submandibular, sublingual, they are opening in the floor of the mouth. Okay, so straightforward parotid gland. Stenson's duct, open, this marks the opening of, right? Next, which of the following terms correctly indicates the marked region? Now this is again maxillary first premolar occlusal aspect. We could see this groove here also. Now this is the tip of the buccal cusp, tip of the lingual cusp. One triangular ridge is going like this, another triangular ridge is going like this. In center, if we join these two, union of two triangular ridges, that is traversing the occlusal surface in a transverse plane. So that is transverse ridge. So transverse ridge is equal to buccal triangular ridge plus lingual triangular ridge, right? Next, which aspect of maxillary first molar has been shown in the picture below? So here we could easily see two buccal roots are facing, two buccal cusps are easily seen here. This buccal groove is present, okay, and we could see a part of palatal root also. So buccal aspect of the maxillary first molar is seen. Okay, straightforward. Sometimes you do get such simple questions also. Next is given image represents which of the following cuspal forms. Now here one of individual tooth is made up of three cones, so that is triconodont, wherein the three cones are present in the same line, anterior to posterior, and the middle one is the longest, right? So this is triconodont. Haplodont will be just one cone, single cone. Tritubercular, three cones but occupying three angles of a triangle. Quadritubercular, four angles of a quadrilateral. Next, given below is an occlusal aspect of which of the following? Now, roughly hexagonal, not exactly. So cannot be maxillary first. Closest to first is maxillary second premolar. More rounded, more curved, less angular, means angles are not that very prominent. And you could see some supplementary grooves also. So these supplementary grooves gives wrinkled appearance because of lots of supplementary grooves. That is maxillary second premolar. Next, identify the cusp marked as 1, 2 and 3. First identify the tooth, that's mandibular first molar. So now you could easily see the smallest cusp of all, that is the distal cusp. So this is the distal side, this is the mesial side. So here we have number 2 distobuccal cusp, and this is mesiobuccal, but mesiobuccal they have not asked. Mesial के back side पे what you're looking slightly pointed raised in, that is mesiolingual cusp. So it will be distal cusp, distobuccal cusp and mesiolingual. See, 3 is not towards, 3 is pointing towards mesiolingual, it is not pointing towards mesiobuccal cusp. Okay. Easier one. Just see what numbers they are asking. Sometimes despite of knowing the correct answer, in hurry we say okay, which all three cusps we are seeing first, we go for mesiobuccal, distobuccal, distal. जल्दी से distobuccal वाली ऑप्शन पे लगा दिया तो वहीं पर आंसर गलत. Okay. Next, which of the following terms correctly explains the image of 9 to 10-year-old child? Age is important. What are you seeing? Central incisors. There is a midline diastema is there. Spacing is there. So in 9 to 10 years, this is the time when canines are erupting. So what do we say? Broadband phenomena, ugly duckling stage, also known as ugly duckling stage, seen at the time of eruption of canines. Self-correcting anomaly है, self-correcting malocclusion है. Once the canine erupts, the space will close. So after 12 to 13 years, if it still persists, then treatment is required, otherwise observation. Identify the marked structure in the image. Now this is the lingual aspect of maxillary canine. We could see right in the center there is a ridge. Now this ridge is dividing the lingual fossa into mesiolingual fossa, distolingual fossa. Okay. How can you identify which side? Now mesial slope in maxillary canine, this is smaller than the distal slope. Okay. Though a very closer one in this picture, in maxillary canine, mesial distal slope is longer than the mesial slope. Okay, so lingual ridge is dividing the lingual fossa into two parts: mesiolingual fossa and distolingual fossa. Next is the following anomalies shown in the central incisor, that is characteristic feature of. So what are we looking at? The yellow arrows. Incisors, they are notched. So notched incisors, a kind of enamel hyperplasia that is seen in congenital syphilis. Such incisors are also known as Hutchinson's incisors. Now molars, they look like mulberry molars or Hutchinson's molars, also known as Fournier's molars or Moon's molars. So basically this, because of the syphilis, it simply represents a kind of environmental enamel hypoplasia. Okay. Next, which of the following marked teeth do not have two antagonists? Do not have two antagonists. Again, numbers are just for the sake of options. So we know that the teeth which do not have two antagonists are mandibular central incisor and maxillary third molar. So among this, mandibular central incisor has been numbered option 1. So 1 is the correct answer. Okay. Mandibular central incisor, the smallest, the most symmetrical tooth, it will not make contact with two teeth. It will make contact only with one opposite tooth. Okay. Another tooth to have this is maxillary third molar. Okay. Each maxillary tooth will make contact with two mandibular teeth. One same tooth, one tooth distal to it. Each mandibular tooth will make contact with two maxillary teeth. One same tooth, one tooth mesial to it. Okay. Maximum supplementary grooves are seen in mandibular central incisor. No, we would supplemental grooves in mandibular central incisor. Did you read that somewhere? See, when we talk about occlusal aspect, we take third molar number 1 and then we take number 2 as maxillary second premolar. Okay. Okay, Ayush Jain has asked for wrinkled appearance. First choice is third molar, then maxillary second premolar. Yes, Ayush Jain, first choice is third molar, followed by maxillary second premolar. So this, we have a few more questions. What are the number of lobes that make up each of the following? So this is central incisor, premolar, and molar. So we know that central incisor and premolars, they are made up of 4 lobes, right? Molars made up of mandibular molar is for 5, whereas maxillary molar, if cusp of carabella is not present, number of lobes is equal to number of cusps, that would be 4. So here it will be 4, 4 and 5. Okay, option D. For maxillary first molar, even if they have not mentioned cusp of carabella, we will take 4 lobes. Okay, for mandibular first molar, 5 lobes. Number of lobes is equal to number of cusps. Okay.